Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall, and tonight we're going to start out talking about high blood pressure, and then we'll get to general questions. Hi, Mom and Dad, Dr. McDougall and Mary, great to see you. How are you?
Hi.
We're doing pretty good. It's been a whole week, and so I'd have to say we're doing really well. We've got a program running now, which is always enjoyable, Heather. I have to tell you that, unless I'm working with patients, I'm not really having that much fun. But we've got a big program this time. I know you filled up a month or so early, so it's been good, to say the least.
Been fun. We've been busy. We just finished up with Jack Dixon. He was doing a whole fitness review on functional fitness, so that was fun. And
Well, I bet they like that.
Oh yeah, he just got done, and now here I am. So great to be with you all.
All right. Well, I wanted to talk to you a little bit about high blood pressure. Not a lot. In fact, I may not get through the whole presentation tonight because I know you want to get on to questions, but I wanted to talk to you about this common problem. How common is it? Well, if you're maybe as many as 40% of the population has blood pressure too high, for an ideal. What's an ideal? Well, that's a blood pressure of, say, 110 over 70 millimeters of mercury.
Oh, you think it's that low? I bet there's more people than that.
You think more people than that?
Yeah.
Well, if you define high blood pressure as 140 over 80,
Yeah.
then it's about 40% of the population.
Really?
Yeah.
Okay. I would have guessed more like 60%.
Yeah. Oh, it's almost universal. But they say they don't know the cause of high blood pressure. Maybe anxiety. Maybe stress. I was always taught it was stress, and you just got to treat it. You got to make the blood pressure low. That's the whole goal, is to make the blood pressure low, and that's the message that I've been taught. Well, the blood pressure goes up because it's supposed to. It goes up as a consequence of three possibilities. One possibility, which is represented in the first picture there, which comes out of McDougall's Medicine, A Challenging Second Opinion, that I published in 1984. You see that the pressure goes up when you increase the volume in the body, and you do that by adding salt. Then you increase the volume, and that's the center picture. So by adding salt, you increase the volume. The other way you can increase the blood pressure, which is the left-hand picture, is by getting injured, excited, exercise, and you increase the pump activity then. So these are normal physiologic things. You'd hope your blood pressure would go up when you exercised, and you'd expect some type of reaction if you're in pain, and that reaction is the pressure goes up. Flight and fight, is basically what you're getting ready for. So you need pressure for the heart and the tissues and the legs and so on to run away from that saber-toothed tiger, whatever. It's a normal, natural response. But anyway, if you eat a high salt diet, you can increase the volume and raise the pressure. Likewise, you can lower the volume with diuretics and reduce the pressure. So those are two ways that are normal physiologic ways for the blood pressure to go up. But the real way that I want you to concentrate on is by increasing peripheral resistance. I mean, that's the important thing. That's what we're going to focus on, is peripheral resistance to flow. It's just like when you drive a car and you've got an oil gauge and you've got a whole bunch of oil tubings going through the engine. If you plug it up, what does the oil gauge say? It says the pressure is really high. So if you plug up the system in the body, what happens is the pressure goes up because it's supposed to. You have to deliver oxygen and other nutrients and remove waste products from your legs and your arms and your scalp, etc. So if you're having a reduction in flow due to an increase in peripheral resistance, like when we're out in the garden and you put your thumb over the end of the hose, what happened? You didn't walk over there and water the flower. You were just too lazy. You put your thumb over the end of the hose, you decrease the diameter through which it can flow, you increase peripheral resistance, and thus you can increase the pressure. So we have to ask ourselves, what is increasing peripheral resistance? What's causing this? And there are various things that cause it. I told you one, if you eat a lot of salt, you increase the volume. I told you a second one, which is exercising. But how about this peripheral resistance stuff? Well, that occurs as a consequence of blockages. And you see the blockages here. This is atherosclerosis. These are old scars. And this is typically what happens throughout life is people start with clean arteries as little babies. And then if they go on formula, kids are starting to have atherosclerosis at 8 months of age. In a study done in New Orleans, 100% of the kids by 2 years of age had the beginnings of atherosclerosis. Now, of course, they were bottle-fed babies and typical American diet-fed babies. So it begins early in life, and then the arteries progressively close with these blockages due to injury. And then injury is the food. And so the blockages get thicker and thicker and thicker, and they increase peripheral resistance as a result. And now that's not what causes a heart attack or stroke. Some of you who followed, my lectures along realize that this hard fibrous material that causes physical blockages is scar tissue. It's calcium. It's stable. It's non-lethal. It doesn't kill.
This is what you would see on a calcium scan.
Well, actually, you see more pictures. This would be more like a artist rendition
Oh, okay.
of what you see here, but it's inside of it.
It'll be like, yeah, okay.
Okay, but you can see you
Those
physically
scars.
decrease the diameter for
Yeah.
which, so you essentially put your thumb over the end of the hose.
Yeah, because it's much skinnier.
Right. And you can see this throughout life on the right-hand side. The picture, this again is a drawing out of McDougall's medicine in 1984. So that's what, 40 years ago, I wrote this. But you see the progressive closure. And as you close it, it's like putting your thumb over the end of a hose. You increase the pressure because it's supposed to go up because it needs to deliver nutrients and oxygen and to remove waste products from your tissues. So the body only has a certain way to respond when you increase peripheral resistance. One is that it can increase the rate, but it also can increase the pressure in the system. The other way that the pressure is increased is through eating fat. And this is what people do, 3, 4, 5, 10 times a day on the American diet, is they eat a high-fat meal. Here you see a picture of what happens on fat feeding. This happens to be in an experimental animal. But the blood is flowing by very easily and quickly. And then you feed the fat, and the blood cells stick together. You see that clumping? That's called rouleau formation. You can imagine how this occurs throughout the body and increases peripheral resistance. You got all these blood cells sticking together in clumps. Well, here's the work done on people. This was published by Peter Quoll and a guy named Williams, and they published it in the 50s and 60s. But you could do the experiment today or tomorrow, and you get the same results. You see the picture of the man here on the right-hand side with the microscope set up, and you're looking at the whites of his eye. He's a 44-year-old fireman. And you see the blood vessels in the eye on the left-hand side, okay? You see lots of blood vessels in the sclera, which is called the whites of the eye. And then you feed the high-fat diet. And what happens is what you saw in the motion picture on the left is you see the blood cells sticking together and clumping and virtually stopping the flow of blood. You see vessels have disappeared 4 hours later when you look at the right-hand frame.
Now remember, that's the same
area of the
same area of the eye, right?
So, you had a whole bunch of vasculature to pump blood into. You didn't need much pressure on the left. And then you close off the circulation, you increase peripheral resistance, and now the heart has to work harder to deliver nutrients. So where you want to focus your attention is on the arteries. You want to make them healthy. It's not the high blood pressure. The high blood pressure is the result of sick arteries. It's not that the blood pressure makes the arteries sick. They get sick from the food we eat. Now, we have the idea that people tell me all the time, they got to get their blood pressure down. So say 150 over 100 to say 130 over 80 or 110 over 70. Try and get the pressure down because they visualize in their mind that somehow this pressure is banging on their arteries, and because of the elevated pressure, it's doing damage. That's not what happens. As a matter of fact, where you have to start with this whole process is understanding, what comes first, the chicken or the egg? That's probably a bad pun. But what comes first is the artery damage. And then the pressure goes up. Not the pressure goes up and causes the artery damage. healthy arteries don't break. Let me show you the evidence for that. First of all, I tried to imagine what dying of high blood pressure would be like. Can you imagine somebody dying of high blood pressure? What would it look like? And I couldn't figure it out. People have strokes and heart attacks, but this pressure causing you to have some kind of explosion in your brain. The only thing I could relate to is a movie I saw many years ago called Scanners.
That's a great picture.
Yeah, where aliens came down and caused people's heads to shake and blow apart. And so that's not what happens. No, but what happens is you end up having rotten arteries, which rupture and give you heart attacks and strokes and impotence and hearing loss and all kinds of problems, back pain and all kinds of problems. The fact that healthy arteries don't break is demonstrated in a couple of slides I'm going to show you. This is an examination of weightlifters lifting heavy barbells. And they took a group of weightlifters and they measured their pressure when they were lifting these heavy barbells. And the average pressure was 320 over 250 millimeters of mercury. Not a single vessel broke because they were healthy vessels in these relatively young men. Remember, normal blood pressure is 110 over 70 or less. But look at 3 times as much blood pressure, not a single vessel broke. Okay, you want a better demonstration of why blood vessels that are healthy don't break and it's not a problem? And the blood pressure is the result, not the cause? Take a look at this. This is a cadaver study. This is on 10 human beings. And what they did is they took, on these dead people, they took arteries from their brain, the ones that you'd expect to fail, to give you a stroke. And they took little segments of arteries and they set it up. They tied off one end of the artery, with a knot so the blood couldn't flow through it. And they put a pump on the other end of the artery and they pumped up the artery to see how much pressure would be required for the artery to break. Remember, normal blood pressure is 110 over 70. You guys are being treated for blood pressures of 160 over 100. All right? They had to blow up the system to 1,786 millimeters of mercury before any vessels broke. Healthy blood vessels don't break. And that's why treating high blood pressure with pills to make the blood pressure come down does not solve the problem. There's little to no reduction in strokes, and there's no reduction in heart attacks from treating your blood pressure. And there are all kinds of complications to treating your blood pressure. I think, Heather, what I'm going to do is I think this now would be a good time to stop until next week. And what I'll talk about is the proper way to treat high blood pressure when medication is indicated, when medication is harmful, and really how to deal with the problem, which is to clean up the arteries. You don't want to stop exercising. You don't want to stop raising your blood pressure for that reason. You need to learn how to clean up the arteries.
Do doctors actually tell patients that their arteries might break if they get too high of a blood pressure?
Well, I think they give them that impression. I don't think doctors really have any idea, Mary.
Oh, okay.
I don't think they really make the connection. I think they're probably practicing under as much misinformation as their patients are. Unless you have a particular interest in this, and then, of course, you have to come to the conclusion that it's sick arteries that break and healthy arteries never break. And the reason the arteries are sick is because of the diet, uncontrolled fork and spoon. Remember this picture. 10 cadaver arteries, human beings. It took 1,786 millimeters of pressure to burst the arteries on average. Arteries are strong. When you do angioplasty, you stick these catheters up into the artery and you blow up a balloon, you create a pressure in the artery of 12,000 millimeters of mercury, and vessels don't break. Cardiologists see that every day. They stick these tubes up into your heart area, your heart arteries. They blow up a balloon called angioplasty or percutaneous coronary intervention, PCI. And they take this balloon and they blow it up in the balloon to break the plaque, the hard fibrous scar, non-lethal, by the way, until you break it. When they break the plaque, it takes 12,000 millimeters of mercury, and the arteries don't break. They just crack up the plaque. Get over it. It's not. You gotta focus on the arteries, or you're not going to cause any benefit. It's just like when we talk about atherosclerosis in general. Those of you who are focusing on the cholesterol by taking statins and other cholesterol-lowering medication, you're missing the problem. Nobody dies of high cholesterol. Nobody dies of high blood pressure. Nobody dies of high blood sugar. Nobody dies of high uric acid. These are risk factors. They're signs that your arteries and tissues are in trouble. You die from food poisoning. And the food poisons that I've talked to you about are in two categories. And those categories are animal foods. That means animal parts, their feet, their butts, their wings. What else do you eat? And their secretions. In other words, milk and cheese. You stay away from all animal foods, and you stay away from free oils. Not the oils in plants, but the oils in bottles, like safflower oil and corn oil. And what you eat, because I know I just took away all your food. Some of you, I just took away everything you know to eat. Oil and animal foods, you're thinking, there's nothing to eat. I'm going to starve to death. And then we open your mind and help you realize that the human diet is based on starch. We're starchivores, starchitarians. You're a starch eater. You really need to figure that out. Why do I say that? Because that's the way essentially all human beings have lived throughout all of verifiable human history. They lived on starch-based diets until they became rich, like kings and queens and pharaohs and priests and Americans and Europeans and Australians and now Chinese. Yeah, they lived on starch-based diet, rice in China, corn in Central America, potatoes in South. Why do you think after 1,000,000 years of evolution that all of a sudden we discovered the right diet in the last 50 to 150 years? You can't figure that out. You look at people, you look at the obesity rates. 91% of people are too fat for their health. Wow. Anyway, open your eyes. It's easy to see. You don't have to be a doctor or a scientist. Just pay attention to what's going on. Anyway, next time I'll talk to you about how you properly treat high blood pressure, when you use medication, and what the various treatments are, including a very, very, very powerful dietary therapy known as the rice diet. I'll talk to you about that next week. All right, Heather, we got any questions? All
Okay,
right.
lots.
Here's another picture of the artery. I'll just show you that. You see how it's open here on the left? Easy to flow. Then you see how it progressively closes as you continue to damage with your fork and spoon, and you have less area through which the blood can flow. And that's why the pressure goes up, because you increase peripheral resistance. You do it by making the arteries diseased. And then what happens is a plaque ruptures. It's not that the closure of the arteries causes a heart attack. It rarely does. It's sudden rupture of a plaque that does. All right, we'll leave it at that. We'll talk about treating high blood pressure next time. So,
Thank you.
all right,
Okay,
let's see if I can get
before we get started, I want to wish you a little belated happy birthday, Dad. Lots of people
Oh,
are
thank
typing
you.
in the chat, happy birthday. So,
Well, it's do I have the Zoom the slide stopped?
yeah, you've stopped.
All right. Well, thank you. I'm 77, and I'm really happy to be 77 because folks, not like many of you, I've got a limited number of years. I mean, you do too, but I've lived my life pretty much at 77. I'm just glad I'm doing as well as I am, and it wasn't going to go that way. Some of you know my personal history. You know that I was almost dead in my mid-20s. I was 80 pounds heavier than I am now. I had a massive stroke at 18. I went under abdominal surgery at 24. My mother called me fat when I was 22. I'd have been dead. But hey, I got some knowledge as a sugar plantation doctor, and I figured out I was killing myself with my fork and spoon. So here I am, but more than 50 years later, alive and well and fully functional. And I mean fully functional. Just took a great walk this morning. Yeah. Anyway, thank you for the happy birthday wishes. I would certainly like to enjoy more good years, as you should plan on doing, especially if you obey the rules. And the rule is one of the basic rules. They're simple: a little sunshine, a little safe exercise, and a starch-based diet. Those are the rules. No destructive habits, you know what they are. Tobacco, alcohol, riding without your safety belt, stuff like that. It's really not that hard. But the food thing, I know everybody's all goofed up about that. And Oprah Winfrey's making it worse. I've never watched Oprah Winfrey's show. I was almost on her show. I was almost a guest. I turned it down. It was a mistake, but it was before she became very popular. She was in Chicago. And I was invited to be on her show, and she never invited me after that. But she had Dean Ornish on the show, and Dean taught her about a starch-based diet. But Oprah has spent her whole career shaming fat. Remember, she bought that big wheelbarrow out with 50 pounds of fat in it. And so she's admonished people all this time for their diet. Well, the reason she had to admonish people about it is because she constantly struggled with it herself, because she could never figure it out. And now she comes on last week and she apologizes to the public for misinforming them about the importance of self-control, about diet, because now it's Ozempic. She's no longer sponsoring what Weight Watchers. She's sponsoring these semaglutides, the GLP-1 agonists, Ozempic, Wegovy, and I don't know which
her
brand.
brain was working against her all this time. It had nothing to do
With the food, right?
with the food.
She just needed a shot. Well, that's what you're going to hear from her, and she's very influential. It's just too bad. I made a list for you. I don't know whether Heather could pick it up easily or not and make it available for you, but it's a list I'm really proud of. It compares the McDougall diet with what you get from semaglutides. You get equal weight loss with our program, no pain, no throwing up, no bone loss, no muscle loss, no sex drive loss on our program, but the semaglutides give you that and more. They make you sick. And plus, you reach a plateau. You don't reach a plateau in our program until you hit trim body weight. You lose 38 pounds, costs you $17,000 to lose that 38 pounds. Takes you 68 weeks to lose it. And then you hit a plateau, and then you're done. You're done. You don't lose any more on average. But if you stop the drug, you regain the lost weight almost always. So why don't you just get it fixed? Why don't you just get it right? Why don't you just do a starch-based diet and get on with your life? And of course, the more you study what I put out and what our team tries to teach you, the more you'll come to that conclusion. I have no doubt. The information is correct.
Thank you. Lots of questions coming in about blood pressure and heart disease. And I do want to mention that we are giving away the McDougall program for a healthy heart book this week because we're talking about blood pressure and heart disease. So you can download that. I put the link in the chat and also the show notes. So do we need to worry about low blood pressure if we're not on any medication?
No, not if you're not on any medication, no. Unless you're bleeding to death. That could be a problem. But if there's no obvious reason for you to have a low blood pressure, like a gunshot wound, blood loss, a car accident, having no water for 3 or 4 or 5 days, if it's nothing obvious, then your body will correct and adjust as it should, so it properly delivers the oxygen and nutrients and cleans up the waste in your peripheral tissues. And if you need more blood flow, the pressure will go up or the heart rate will increase. So no, it's never a problem. But next week, we'll talk about how over-treatment of blood pressure with pills kills. You see, that's the problem, is that there's a very narrow range at which you should treat with medication. It's very small. If you treat too much, you increase the risk of strokes and heart attacks. You treat too little, and you probably have an increased risk of problems. So you got to get in that narrow range, and that's really tough to do. But we'll talk about that next week. So how often should you check your blood pressure? I probably checked mine 2 years ago. But it's always been normal. Why would it change? I haven't changed. So, you might out of curiosity check it once a year. Buy a cuff. They're pretty cheap. $75 you get a good cuff for, or go to the fire station or police station. They'll take your local medical, whatever. They'll take your blood pressure.
They have machines in grocery stores.
Yeah, that's right. Yeah. And I do. I stop by sometimes and I just test it out to see if I'm okay. All excited from shopping and everything, walking around, still registers normal. What do you know? So yeah,
Thank you.
you don't have to worry about it.
Ruth is writing in, what about those of us that have white coat syndrome and have, a high blood pressure when we see the doctor, but when we're at home, it's normal?
Right. Well, that's what counts. That's what counts. So, treating anxiety, the fact that you're afraid to see your doctor, you're afraid as to what's going to happen. What do you expect? Most people go to the doctor with fear and trepidation. Because it's so often bad news when you're off to see a doctor. And unfortunately, a good share of my profession hasn't figured out that their job is to make people feel better. And well, that's one of the things I teach the medical students is, look, no matter what's wrong with the patient, before the end of the visit, you need to find something really positive you can say to this person. You don't want to have them leave the office depressed, confused, frightened. And you have the power as a physician to give at least something encouraging, like, boy, your eye grounds looked really good. Or, anyway, your skin looks great. Or saw you walk in here with a big step and a big smile. I know you have cancer, but I can think of something good to say to you. Anyway, so you're scared when you go to the doctor. So it is the official recommendation of the American Medical Association, the American College of Physicians, etc., to not pay attention to office blood pressures. Everybody in the profession knows that. So yeah, you should take it to home in a relaxed situation. We'll talk about that next week as to what the situation should be. And then there's monitoring. You can monitor. They have monitors you wear for like a day or two. That gives you readings throughout the day. And before I would even think about starting medication, if I met the criterion that said that medication is indicated, I would at least go, for a 48-hour test with this constant monitor, because you're committing yourself to a lifetime. The doctors are taught by the drug companies that once you're on blood pressure pills, you'll always be on blood pressure pills. Well, not for our patients. We get 90% of the people that our data is published. Out of 1,703 people, we got over 90% of the people to reduce or stop their blood pressure and diabetic medications in 7 days. So that's complete nonsense. Yeah, if you stay the same, you keep eating all the garbage and taking poor care of yourself, then your high blood pressure condition will never go away. But are the pills helping? Probably not. We'll talk about that next time.
Thank you. What would you say to a mother who cannot breastfeed for one
Well, that's
reason or
tough.
another?
Yeah, that's tough. And we've run into this in our family. I have 7 grandchildren, and fortunately, 5 of them were breastfed without any difficulty. And for those 5, I felt really good, because a bottle-fed baby has 60 times the risk of pneumococcal pneumonia during the first 3 months of life if they're bottle-fed. So my breastfed grandkids, they got sick. I was pretty confident that they were going to do just fine. And I wasn't with the other 2 because they didn't have the advantage of breast milk. Let's just say that the reasons that this mother could not breastfeed were legitimate. Often they're not. I believe in this case they were. But say they're, you have a mother-in-law who says, look, you don't want to breastfeed because your boobs will hang, or you look funny when after you're done, and age you quickly, or why do you want to be tied down with, all kinds of nonsense. And plus, up until recently, I don't know whether they still do this, the drug companies supplied formula for mothers when they went home from the hospital. I think they stopped that practice, but that was up until recently. And so here you're being told by people you respect, nurses, dietitians, doctors, you're being told by being handed a package of formula that this is what you're supposed to do.
They give you a little bag, and
Yeah.
it's got diapers in it, and wipes, and formula, and anything else you might need for a newborn baby to go home from the hospital with.
Well,
And I got one
Yeah.
that I refused when Heather was born. And by the time Patrick came around, they knew better.
Yeah. Well, if you have trouble breastfeeding, the first thing you want to do is get yourself a breastfeeding consultant. You know, there are people, I would guess most of them are women, around your community who specialize in helping you get through the first few days, which are tough. You know, if you know, I certainly can't show empathy, but I can certainly show some sympathy. I watched them go through the initial adjustment. So you get somebody to help you. In the olden times, there was mother-in-law or mother or sister because it was a tight community. In this day and age, you have to hire somebody to get some help, or maybe you have a good friend, which takes me back to the old times again, when if you had problems breastfeeding your baby, what you did is you handed the baby off to the sister or to your best friend. Okay?
Or you hired a wet nurse.
Yeah, really. I mean, yeah, they used to.
Yeah.
In fact, we were watching some of the stories about the plantation communities in the South and how they had, well,
Yeah.
that's a whole story. But you know, they you know, many of the plantation owners, they didn't feed their own children. They had their slaves feed the children. Anyway, that would be the ideal thing is to hand the baby off. And you wouldn't want to do that today because you're handing your baby off to women who are sick, who have high pesticide loads in their breast milk, which brings me to the next phase. If you're not going to do that or can't do that or don't want to do that, then you can always get milk from a bank. Or you can get it, you can hire women to provide breast milk for you. That was a choice we had with the two babies that couldn't bottle breastfeed. And what I chose was to make a formula for them rather than feed them other women's milks. Why? Because of the contamination of women's milk if they eat the Western diet, which basically all women do. The milk is so contaminated with pesticides, other environmental cancers, cancer-causing chemicals, brain damage-causing chemicals. Back in 1979, the Environmental Protective Agency, the EPA, did a study of 1,400 women in 48 states in the US. And their conclusion was breast milk is toxic. It's a health hazard. And, you know, that really upset the whole bottle breastfeeding industry when these reports came out. I read recently about women from Alaska who eat a very high meat, you know, mammal and fish diet still. The native Inuit Eskimo women, and their breast milk is so toxic that the recommendation is to bury it in a toxic waste dump if it's left over. So anyway, I didn't want to feed another woman's breast milk to our infants unless, of course, they ate like we did. And to find somebody who had clean breast milk would be a chore. So what did I do next? Well, you'll find out what I did next if you go to my website and you go to Hot Topics under Nutrition. You read the chapter on children and pregnancy. There's a whole section, and it's something about children are our future. And in the middle of that, it tells you how I invented the formula to feed two kids that couldn't be breastfed. What we did, and my son is a chemist, by the way. What we did is we went to the store and we bought various kinds of formula. And we bought a kind of formula called denatured formula, or hypoallergenic formula, it's also called. And it's sold in the United States in grocery stores, drugstores, et cetera. In New Zealand, you have to get a prescription for it. But in the US, you can buy it over the counter. So the reason I picked this denatured cow's milk protein is because the intact proteins are broken down into individual amino acids, so you wouldn't have the problem of setting the baby up for type 1 diabetes or other autoimmune diseases, because they break up the proteins into individual amino acids, so they're not allergic or don't cause autoimmune diseases. But the problem we ran into there was that the hypoallergenic formula tastes terrible. But we bought some of the regular formula and we looked at the ingredients so we could see why. They put sugar in the regular formula, and they have no sugar in the hypoallergenic formula. So what we did is we added a little bit of table sugar to the baby's formula, denatured hypoallergenic formula, so the child would eagerly eat it. And slowly we reduced the amount of sugar in the formula. But that's what I would recommend, is that I thought about it a lot. You know, I have a pretty good background in making these decisions. Ideally, you would be able to breastfeed yourself. Secondarily, you'd find somebody, friend or relative, who ate the McDougall diet. In other words, didn't eat all the animal foods that bring you the pesticides and other contaminants, and have that woman take over in a very important job. You know, bottle-fed infants, they have a tough time starting out in life, and it carries on through adulthood. So you want to give your child a good chance of starting out right, and that's breastfeeding. And I hope you find that helpful and not confusing.
Great, thank you. I put the link in the chat on pregnancy and children, so you can read more if you would like.
Yeah,
Okay.
that's a whole
Go ahead.
really good discussion, lots of references on why children should eat the McDougall diet. The thing is I know there's a lot of emotion and education and brainwashing behind what you believe in diet. It affects us. You know, I'll tell you a very personal story. I don't think I've told this in a long time. Is that after we had our first two children, Heather and Patrick, which, you know, we ate pretty much the Western diet. We started making modifications by then. Mary got pregnant again, and we changed our diet when the kids were like 1 and 2 years old. And we'd gone on a strict vegan diet, and we're all doing really good. But then Mary got pregnant again. And all of a sudden, even though I hadn't seen it in months, I saw it, you know, I don't know whether it was fish or chicken or cheese or what, but there were things coming in the household that, you know, I knew we shouldn't have. But because of the education here, we're thinking about children and pregnancy, and you get all emotional and just are so afraid of doing the wrong thing. And so, you know, for a while there, we had more in our kitchen than we usually did. In other words, some of the animal foods kind of crept in to get enough protein, get enough calcium, or whatever else you need to have all these wonderful American babies, which are too fat, by the way. So Mary was cured, and if I had any need to be cured, by the fact that she had a miscarriage. She did everything that every mother-in-law would say you ought to do as far as diet goes, and she lost the baby. All right, so, you know, a couple of years later, she gets pregnant with Craig. I didn't say anything. I was just waiting to see the stuff come back in the house. No, you know, she was convinced, educated about. So I understand it's hard for you when you're dealing with kids and pregnancies. You could do anything to yourself, you say. I could, especially for 12 days, I can do anything to myself. But I understand it's difficult for you to make that transition to such sensitive areas in your life, but I can assure you it's the right decision. You read my January 2011 newsletter on pregnancy, and, you know, if you're really understanding it and reading it, you'll go through your entire 9 months of pregnancy without any animal foods, no milk, no meat, on a starch-based diet. Same thing with children. If you want to have trim, healthy, active, marathon-winning children, then you're going to feed them a starch-based diet. You know, but I realize it's difficult in these areas.
Thank you. Marie wants to know what's wrong with eating fish like wild salmon.
Well, pretty much they're all gone. You know, since I was a young man, and I love the ocean, scuba diving, windsurfing, sailing ocean-going sailboats, you know, the scuba diving, snorkeling. You know, the ocean's really a big deal for me. And the fact that 90% of the fish since I was a young boy are gone. So if you decide that what I tell you is not really what you want to do, you better eat up pretty fast, because 10% is going to go quickly. But the problem with fish is that it's a muscle. It wiggles a tail, just like a chicken wiggles a limb, and a cow moves a leg. These are muscles. And as muscles, they're pretty much the same. And if you eat fish muscle, as opposed to beef muscle and pork muscle, actually fish and chicken muscle, based on calories consumed, which is the correct way to look at it, have more cholesterol than do beef and pork. Chicken and fish have more cholesterol. And in all the studies done, there are no exceptions. When they switched from red meat to white meat, the blood cholesterol stayed the same. All those references are in my books, or you can look them up. So same amount of cholesterol. Fish has no dietary fiber. It has no carbohydrate, which you need for energy. It is deficient in vitamin C. Remember the sailors went out to sea and half of them died from scurvy. You know, fish had vitamin C. That would have never been a problem. No vitamin C. It's heavily contaminated. I can tell how much fish you eat by doing a biopsy of your body fat and going to the lab and measuring the methyl mercury content in your body fat. I know how much fish you ate. It's a direct correlation, methyl mercury. And the amount of methyl mercury that's considered toxic by the FDA and the USDA is as little as 6 pieces of sushi. One meal of sushi has enough methyl mercury in it to put you over the level that's considered hazardous by our government agencies. So why would you want to eat the fish? It doesn't taste good. You know, raw fish, I mean, being from Hawaii, raw fish was a big deal, but we couldn't get it down without the soy sauce and the hot mustard. There's nothing, no taste to it, no enjoyment. You gotta blacken it or put salt all over it or mustard and sauces, just like any other animal foods. They either have no taste or they're disgusting. They have some terms that you can relate to. When something is called fishy, okay, when something's called fishy, is that a positive description? I don't think so. Yeah. There's a whole bunch of terms related to fish that are all negative that I know of. So don't do it. And you know, for the oceans and for yourself, it's not a good idea.
Thank you.
And
Next
the
question.
fish fat, let me just add one more thing. The fish fat causes you to bleed and suppresses your immune system. Even feeding fish, which is one experiment that I talk about, even feeding fish, the result was, I mean, regular fish is people ended up getting more infections, viral infections, than those who didn't eat the fish, because fish suppresses the immune system. You know, like cod liver oil. You've heard about cod liver oil for your joints. So like they grease the joints, right? No, it suppresses the immune system. That's why it helps. And it does do that. When you suppress the immune system, you have more risk of infection, cancers. They grow faster, and you have bleeding problems. You know, fish omega-3 fats thin the blood. That's why they're promoted for heart disease, because it reduces your risk of a clot forming. Maybe. I wouldn't count on it.
There's lots of conversation going on in the chat right now about water filters and what kind you use.
We have it's called an Aqua True.
It's
a countertop device that I think you can buy on Amazon, and it has filters that you change, and it filters out all the whatever.
Yeah, we've had that particular unit for about 4 years. So, you know, I'm sure there are other good units out there, but we have that, and then we also have bottled water.
Yeah, we have a container that has a big 5-gallon jug of spring water.
Yeah, serious.
And we use that.
And you're right, it's in a plastic bottle, but on that plastic bottle is a code which indicates how likely it is that the plastic will get into your water. And these plastic containers are made very stable. So, you know, the risk of plastics in your body and your water is a big topic these days, and one that you should be serious about. So, but the plastic industry has made some effort to minimize that particular hazard. We saw a great documentary this week I want to pass on to you. It was a grade B movie. documentary. It was on Netflix, and it was called Dark Waters. And it surprised me, Heather. We've talked about Teflon in the past, and I've kind of taken the attitude, well, I've never seen anybody die of Teflon poisoning, but I see lots of people die of fat poisoning. And that was kind of the way I kind of brushed it off. But boy, I tell you, after seeing this documentary, Dark Waters on Netflix, I have to say what I've told you many times before is I reserve my right to change my opinion about things like drugs and poisons and things like that. But I'll never change my opinion about what you ought to eat, starch-based diet. But this is an example where I have to tell you, I understood the magnitude of poisoning of this planet and people from the Teflon industry from DuPont. Watch it. It's worth it. Like I say, grade B, but it's a wonderful message. And it just tells you, when you see DuPont acting that way with Teflon, you no longer have the question about other industries because they come from the same breed, the corporate greed. And it's just money, it's business. So if DuPont would act this way, watch the documentary. You can imagine Kraft and Monsanto and, the whole food industry, the whole drug industries, they're all out for one thing. It's called profit. And if you get in the way, well, we'll try and work our way around that one. They actually build in money to take care of the lawsuits when it comes to various drugs and products. They figure, well, we're going to get sued. We lose this much. But heck, we made this much up in profit. It's worth it. You can protect yourselves. I wouldn't tell you this. This is not trying to spread a conspiracy theory. I'm just trying to help you realize that, what is happening. You can protect your family and your friends. And it's just by one simple maneuver. And that is you eat a starch-based diet with fruits and vegetables. That's it. That's what you're missing. You're probably exercising enough. You may need a little more sunshine, probably, but maybe not. The food, you just got to fix the food. You'll be amazing how many problems this solves.
So last week we were talking about vitamin D, and you were talking about how vitamin D, or I think it was inflammation, can cause low vitamin D levels. Can you tell me where we can find that research? Some doctors trying to get someone on some pills.
Oh, okay. It's you look into my slide presentation on let's see what we're on vitamin D. It would be under vitamin D, actually, a slide presentation on YouTube, and the references in there about chronic inflammation, reducing the, or you can write me. It's Dr. McDougall at drmcdougall.com. And likely I can find the reference for you very quickly. But go to the YouTube, look at the lecture on vitamin D. It's just put in vitamin D and McDougall. The slide should be there with the reference. I think I have a couple of references down there to show you that. So
thank you. I'll try to find that link and put it in the chat.
Yeah.
Question from...
Always try and give you the science. Why? Because there's no reason you ought to believe me than the next person, except for the fact that I'm giving you the information, and I'm giving you the majority point of view, and I'm giving you what I understand to be true, not some minor point of view or some conspiracy theory. The things that I'm recommending, except in degree. People tell you eat a low-fat diet. Well, how low in fat? Well, I think you're pretty lazy. Maybe you should go from 40% fat to 35% fat. Or I know you got a busy schedule. Maybe you can only cut down to 30% fat. Hey, if you're teaching people that kind of compromise, what chance do you have? You need to be taught the best so you can decide how much you want to accomplish. And that's what we teach you. A starch-based diet is the best you can do. No compromise. Anyway, what I was going to say is most of my profession, unless they stand out like the low carbers or maybe some of the cardiology business, most of my profession agrees with me. just not to degree. They see more vegetables, more grains, more fruits. Well, how much more? They said eat less meat, or less processed meat. Well, how much less? You know, you ought to be told the best, which is have to be what McDougall's are doing. They took you ought to eat less, and they made it less. You ought to eat more, and they did it more. So there is no more or less, no less. Once you learn our program, you've got it all. No compromises. You pick the days you're healthy and pick the days you're sick. It's up to you.
Thank you. Video 1000 Nights is wondering whether volume eaters have stretched out stomachs or not.
No. No, they don't. Volume eaters, I don't believe so. Like I say, I put myself through medical school as a surgical nurse. So I must have done a minimum of 4 surgeries a day and as many as 16 a day. So I've been in thousands of abdomens, and I've never heard, never read, never seen a stretched out stomach. Now they stretch out when you eat and fill them up, but they go back to the normal size. It's even if it were true, there's so much bulk in starch that you could fill a stomach twice as big as the one that we normally have, and you'd still be in control of your health. You know, it's not just filling the stomach that satisfies hunger. It's the carbohydrate, the sugar that satisfies your hunger drive. So you've got that, you know, that really overall satisfaction, which doesn't occur just by filling the stomach. If you take fiber pills, they used to sell, maybe they still do, to lose weight. You take these fiber pills, they're just fiber, no calories, and you feel something in your stomach going on for a few minutes, but you haven't lost your hunger drive, because to quiet the hunger drive, the carbohydrate, it's carbohydrate, not fat. Protein will do it too a bit, but it's carbohydrate. It gets in the system. It causes the insulin to go up, the ghrelin to go up or down, whatever. A whole bunch of hormones. I'm sorry, I'll have to look them all up for you. But they're the ones that they use to sell Wegovy and Ozempic and tell you that they got some sexy new method of solving your weight problem. But it's really not sexy. It just gives you Gila monster poisoning. That's all. That's a reptile, Gila monster. You heard of the Gila monster? That's where they get the Ozempic from. It's derived from the Gila monster venom. It's the venom in their lower jaw, not their upper jaw. It's the lower jaw venom. I don't even know if they have that venom in their upper jaw. But that reptile, he grabs a hold of you and bites you, and holds on for just a few seconds, and it bites really hard, but he doesn't kill you. But he makes you feel like you're on Ozempic. You throw up, you got diarrhea, you got stomach pain. Hey, I'm not going to go any further, but you will not be able to buy a Gila monster in the pet store. I know some of you are thinking, well, I can get around the $1,000 a month price tag. I just buy my own Gila monster. No, the Gila monster bite only lasts a few minutes. You got to manipulate the poison to make it last for days or weeks. So, you know, Heather, last week somebody asked me something about using progesterone to delay pregnancy, and I told them I just didn't know.
Oh, yeah.
But I looked it up, and the answer I should have given them, in addition to the fact that I don't know, is you could look it up on Google. It didn't take me but 30 seconds to find the research that says that this was a very positive thing to do and a very safe thing to do, to use the progesterone. So I shouldn't have left that person kind of dangling. I should have given them answers. You could find this out. Just go to Google and go to the National Library of Medicine and ask the question, which is all I did. I just common terms, put it in. I think it was progesterone and delaying labor or something like that. So that's the answer I wish I'd have given you, which I shouldn't have left you hanging there.
Well, I appreciate you following up, and hopefully the woman who was listening last Sunday is also listening this Sunday and can hear your response.
Yeah, well, hopefully we're going to have a growing crowd. It's just really nice. You seem to be telling your friends and relatives to come and meet with John, Mary, and Heather every Sunday at 5 o'clock Pacific time. And you'll find some really nice people, real friendly, who have a really stupid, simple message that costs you nothing and always works. But that's the problem with those McDougalls, is they give it away. I was thinking about that today. Maybe if we sold it, that people would think it has value. Well, we do run a business, and that business is to take you by the hand and to get you through the change. That's our 12-day telemedicine program, which you do from your home. And we're there to help you all day long. We've got support specialists, wake you up in the morning, put you to bed at night. And we got good medical team, dietitians, exercise, and a lot of really good entertainment. I can only tell you and promise you this, it's going to be the best money and time you ever spent. And we have fun too.
Well, of course, the 12-day program is ideal, but not everyone can afford that. And so, like you said, we offer it, so much of it for free on the website.
All of it. There's no gimmick. There's a 12-day free program. Tells you what blood tests to do, what to eat, the menus, the recipes. It's all there for you. Free, no gimmicks, but, changing is difficult. And we are very successful at getting people through the tough times. And our patients do well.
Question from Cherish. She has restless leg, especially at night. Do you have any suggestions for that?
It's a tough one. Magnesium has been recommended, but magnesium increases your risk of heart disease. So I wouldn't go there. There's some doctor prescribed drugs that are supposed to help, but I don't know that they really do. I think a lot of restless leg is that people have insomnia and they don't fall asleep easily. And so they lay there and they twitch in bed a long time. And that is due to the fact that they believe they need more sleep than they really do. If you believe you need 10 hours, beauty rest, escape, dreams, sleep, pleasant, if you're into that type of thing, the more the better, then you're going to get into trouble with insomnia and depression. So the fact, say you only need 5-6 hours a night, which is what a typical adult needs, maybe 7. And you put yourself in bed for 10 hours of sleep, there are 3 hours you lay there and you have wiggly legs. So, but otherwise, I don't know any easy way to deal with it. Don't treat it with a glass of whiskey or with a sleeping pill, which is what too many people do. Do sleep hygiene, sleep restriction. Realize that you're not a baby, you're not a sick person, you're not pregnant. You don't need 14, 16 hours to sleep a night. You need 6 or 7. That's it. That may help some of you. But there's no easy answer to restless leg.
Let's see. Becky went for a walk at an elevation of 9,000 feet with her husband, and they had swollen hands. Do you know why that might happen?
No. Maybe the decrease in atmospheric pressure. Because when you're up that high, you lose 1 atmosphere for every. Do you remember, Mary?
No, I don't.
Yeah, Mary and I are both pilots. We're at one time we're very capable twin-engine IFR rated pilots. And we learned that as you go up every 1,000 feet, you decrease the atmospheric pressure. And so, maybe that's the reason, 9,000 feet, atmospheric pressure down. I would guess so. If there was any physiologic explanation I could give you, that would be it. So, and I'm still alive. They always say a doctor and a baron is certain death, but I made it because I didn't want to die. So I really learned how to be a good pilot.
Okay, that answer made sense. Ruth is wanting to know about hemorrhagic strokes. What causes those? And
well, you saw that rotten blood vessel that I showed you. What happens with a hemorrhagic stroke is instead of a pimple popping on the inside, you have a rupture to the outside of the artery into the tissue. See, with a regular stroke or heart attack, what happens is you've got this lining of atherosclerosis inside the artery. And what happens is a plaque, a hot volatile plaque which looks like a pimple, bursts, and it causes the blood to suddenly clot inside the artery. Now, a hemorrhagic stroke, what happens to the walls of the arteries are so diseased that the blood breaks through and flows into the adjacent brain tissue. So it's not a closure of the artery, it's a matter of a hemorrhage into the brain tissue that occurs. And the same cause, hemorrhagic strokes and thrombotic strokes, which is what the other kind are called, which are the most common: thrombosis, blood clots, thrombotic strokes, are due to the Western diet. And you need to keep those arteries healthy. You need to keep those walls strong. Healthy arteries don't break, okay, under any pressure. I showed you that. Start focusing on the problem, which is the arteries. And a blood pressure pill is not going to solve it. Neither is a blood sugar pill or a cholesterol pill. It's not going to solve the problem. How could it? Just imagine, how could it? When you're taking and competing against, steaks and cheesecakes and ice cream cones and as opposed to what you should be eating: potatoes, rice, corn, etc. You choose. It's up to you. If you don't know, then you join us next Sunday night at 5 o'clock, and I'll tell you how you treat high blood pressure. Remember, the Heart book is available for free this week. It's up to date, even though I published it in the late 80s. Nothing that has to be changed. I could add a few things to it, but they're just repetition of the same information that I put down in that book 30, 40 years ago. Why? The truth don't change. People ask, why do I keep telling the same story over and over again? Who's that rapper? Because the truth. Cray, yeah.
Cray.
He says, why do you keep saying the same old thing? And this rapper asked. He says, because the truth don't change. The truth don't change. It's easy and simple to understand. And once it's yours, and nobody will take it away from you. Doesn't cost anything.
Okay, time's up. That was a great hour. Went by fast as always.
Yeah, when are you going to run the next program, Heather? I know you're filling up already. So
In July,
another one
we
that's
are
coming
filling up. So if you're thinking about it, sign up sooner rather than later.
well, I want you to think about adding an extra program in the fall. I know you have other things to do, so I'm not going to push hard. But anyway,
All right,
we
that was
only
a
have
great
couple.
hour. Thank you all for tuning in. We'll see you next Sunday at 5 p.m. Pacific. Thanks, Mom and Dad, Dr. McDougall and Mary.
All right.